Epidemiological studies evaluating whether metformin use affects the risk of multiple cancers have been controversial. In our study, we sought to evaluate whether metformin use has an effect on the risk of renal cell carcinoma. We used the Health Improvement Network database for our analysis. We performed a nested case control study using that database, which is a well-validated database. Our cases were divided into patients who are long-term users, short-term users, and past users. Long-term users were defined as patients who had used metformin for at least 1 year before their diagnosis and continued using it through their diagnosis. Past users were defined as patients who used metformin for at least 1 year before their diagnosis but stopped using the medication at least 6 months before their diagnosis. Short-term users were defined as patients who started using metformin within 1 year of their diagnosis and continued using it through their diagnosis. Our cases were matched up with up to 4 controls based on age, sex, duration time, practice site, as well as duration of follow-up. Our data suggested that regardless of the duration of metformin use, whether patients were long-term users, short-term users, or past users, there was no statistically significant effect on the risk of renal cell carcinoma.